Hello, I'm Dr. Castaneda, and today we're going to talk a little bit about the non-surgical rhinoplasty. And we have some questions from Facebook and from our social media, so let's start. Usually candidates for non-surgical approaches for improving nose appearance is people with smaller noses. It's not as useful on individuals that have very high nasal bump or very big facial or nasal features. Surgery is usually for removing tissue from the nose so we can shape it. In these other cases, it's people with small noses or people with lack of projection or definition, and then we can add some volume there, and the results are very fast and very good. Yeah, for this type of procedure, we want to stay away from any kind of permanent filler. That can always be problems, and especially on such a small area as the nose. So it's either hyaluronic acid fillers. We can do different type of density, no? So in this case we use Bolift, is a common type of filler, thicker, and regular Juvederm that is, it's like in the middle of thicknesses. This is one of the biggest advantages of this kind of procedure, is that the result is pretty much instantaneous. So it's done on an office visit. It takes about maybe 10-15 minutes, and the results will last for a little bit longer when we use thicker fillers like the Bolift, like 8 months. A little bit less for a softer filler like the Juvederm, around 4 to 6 months, I mean. Since the amount of filler used or needed for this kind of enhancement is quite little, usually 1 syringe is more than enough. So it depends on the cost of how the filler is at this month, but usually it's around $350 for this 1 syringe that will be probably not even used up all the way. Yes, fillers can always be dissolved with an enzyme called hyaluronidase, which is a medication for dissolving the hyaluronic acid, no? So if there's anything that didn't come out as expected, it can always be removed. Or you can just wait a little bit for the inflammation to go down, and that's the usual, no? It's very unlikely that we'll need to be dissolving any product. Yes, absolutely. As in any other kind of these procedures, a lot of people just can grab a syringe and do the injections, but it's important to know what you're putting in, planes, and in case complications arise, you need to know what to do, no? For example, we were talking about the need for dissolving any of this kind of product in case it causes some blockage in some vein or something. This is something that definitely needs to be handled by a professional. It's quite easy, the recovery of it, no? The main point is to avoid squishing the area that we have injected, which is usually the tip area and the dorsum area. Also, if you're wearing glasses or heavy glasses, stay away from those for around 5 days to give time for the filler to set and not be moving around anywhere. But it's very easy. A lot of people do this like for a quick fix, like there's an event, a social event coming up, and it's a nice way to improve fast.